In April, we acknowledge folks who've gone through C-sections. Did you know in the US, about 22% of people giving birth for the first time will have a C-section? Generally, the rate is 1 in 3 will have a C-section. And so for some people, it's a planned C-section, but for most people, it's not. And it's really important to recognize that sometimes second and third time birthers will have C-sections. It doesn't mean you've done anything wrong. I love educating women on this because it's important to know to be your own advocate. Um, if we look at surgeries that happen to other parts of the body, like your shoulder, your knee, and your back, you'll get an instant referral to physical therapy, and there's protocols for that. The big one that everybody knows about with ACL. For ACLs, you can manage it without surgery. There's a protocol for that. With ACLs, you can manage it with surgery. There's a protocol for that. Giving birth should be no different in how we support people as they heal. But oftentimes, it's just figure it out, take your time, listen to your body. Meanwhile, you're sleep deprived, you've got a newborn, and then you've got this like return to work deadline looming over your head. It's important to know that for some people, there are really common complications that can show up, such as back pain, pain at the incision site, pain with sex, bladder leaks, constipation issues. For some people, these things don't show up until like 10, 20 years later after C-section. In my 15 years of being a physical therapist, I've seen just about everything. So I really wanted you to know that being your own advocate is key, because if your doctor's not recommending, just because your doctor's not recommending something, doesn't mean that you can't seek it for yourself.